Welcome, future nurses. Today we'll review 10 important RN concepts. Listen carefully and think about your answers before I explain them. Question 1. A patient has a blood pressure of 88/56 and reports dizziness when standing. What should the nurse do first? The priority is to assess the patient and ensure their safety. Low blood pressure and dizziness increase the risk of falls and may indicate poor circulation. Question 2. A patient has a respiratory rate of 8 breaths per minute. Why is this concerning? A respiratory rate of 8 is below the normal range for adults and should be reported immediately. Slow breathing can reduce oxygen delivery to the body's tissues. Question 3. A patient with diabetes is sweating, shaking, and feeling confused. What condition might the nurse suspect? These are common signs of hypoglycemia, or low blood sugar. Early recognition and treatment are important to prevent serious complications. Question 4. What is one of the most effective ways to prevent the spread of infection in healthcare settings? Proper hand hygiene before and after patient contact remains one of the most important infection control practices. Question 5. A patient suddenly develops chest pain. What should the nurse focus on first? The nurse should quickly assess the patient, monitor vital signs, and follow emergency protocols. Chest pain can indicate a serious cardiac event. Question 6. Which patient is at the greatest risk for falls? Older adults, especially those experiencing dizziness, weakness, or balance problems, are at a higher risk for falls and injuries. Question 7. What is the normal oxygen saturation range for most healthy adults? Most healthy adults maintain an oxygen saturation between 95 and 100%. Levels below normal may require further assessment. Question 8. Which electrolyte plays a major role in maintaining a normal heart rhythm? Potassium is essential for proper heart function. Abnormal potassium levels can lead to dangerous cardiac arrhythmias. Question 9. Before administering any medication, what must the nurse verify? The nurse must confirm the patient's identity and follow the medication administration rites to ensure patient safety. Question 10. A patient suddenly becomes short of breath and anxious. What is the nurse's priority? The nurse should immediately assess the patient's airway, breathing, and circulation. These acts are the foundation of emergency nursing care. Excellent work, everyone! Remember, successful nurses focus on patient safety, critical thinking, effective communication, and compassionate care. Keep studying, keep practicing, and you'll be one step closer to becoming a skilled registered nurse. See you in the next RN review session.